Mr. Clerk, please report House Bill 274.
House Bill 274, an act relating to the practice of pharmacy.
And the problem that we're facing here is that Kentucky is facing a public health crisis in regard to childhood vaccinations. According to the CDC, Kentucky ranks lower than 5 of the 7 surrounding states when it comes to vaccinations for things such as measles, mumps, rubella, tetanus, diphtheria, pertussis, polio, and the list goes on and on. And even for children beginning preschool, we lag behind the national average, which is not surprising given the shortage of healthcare providers in our state, which is even more pronounced in rural Kentucky. You know, according to the American Board of Pediatrics, 51 of our 120 counties in Kentucky do not have a general pediatrician. So it stands to reason that we would be lowering our vaccination rate. However, what we are blessed with are community pharmacists. 90% of Americans live within 5 miles of community pharmacists. And we previously extended the privilege to them to administer vaccinations for children up to the age of 9. What this does is broaden that to allow them to provide vaccinations to children age of 5 and above. It does not introduce any new vaccine mandates, does not expand the scope of practice of pharmacy, and does not replace well child checkups. This is in partnership with the general practitioners that do exist in rural Kentucky. There are some amendments on the bill, Mr. President, and I would yield to the Senator from Oldham for action on those amendments.
Before I make a motion to withdraw Senate Floor Amendment 3, out of honor that I said I would like to speak on that motion.
Please proceed.
Mr. President, I feel most in this body believe that there was an overstep of government into our lives during the COVID pandemic. And one of the issues that we did not address and have not addressed to this point are employer vaccine mandates and the allowing of exemptions. And that's what this floor amendment would have done. It would have, it would require an employer not to affect the terms, conditions, or privileges of employment without allowing for an exemption based off of religious or medical reasons. And we have exemptions in other areas. Our long-term care facility residents and employers actually are allowed to have exemptions for certain vaccines, as are our students in K-12 institutions. But overall, our employees are not allowed to have those same exemptions unless by that employer's discretion. And I think that's an important issue. I hope it's one that we will address in the future, but I will make a motion to withdraw that amendment in order for this bill to move forward.
Cast a no vote and explain, Mr. President.
Please proceed.
Mr. President, we really need to figure out what we want to do around here, because every time I turn around, there is some other carve out to what we have already established. And I understand we haven't established perfect things, but let's talk about what this bill really does. This bill says, let's have pharmacists be able to administer vaccines to children even younger because their parents want them to. Now, what in the world does that have to do with scope of practice, educational levels, whatever? And I know our pharmacists have been administering vaccines when we're in states of emergency. And we're done with emergencies. In fact, I think it doesn't make any sense at all to have it happen in emergencies anyway. Are pharmacists dispensing drugs, or are they administering vaccines? Now, I sure would like to see more organization to scopes of practice and standards of care and all these things, either that or let's go to the free market. But to have us sitting up here talking in Frankfurt about which age your child has to be in order to go to your pharmacist to get a vaccine, because somehow this is such an important thing that your kid needs to have, and we certainly can't see a regular practitioner about it. I'm just baffled why we're talking about this. At the same time, we're not talking about all of the other issues relating to vaccines that have been going on for literally decades, but particularly the last couple of years. And time and again, we see government protecting certain interests and not the individuals of the constituents that we represent. It's just really actually an outrage to see bills like this come through and nobody is talking about the real issues or having any really deep discussions on what are we doing and is this a comprehensive approach. A long time today, but I'm not talking too long because there's just so much to say we don't have time for today. But I think that this body needs to really get serious when we're dealing with health care. If we're going to be meddling all the way in it, we need to be educated before we do so. Thank you.
My problem with the bill, when a parent brings, or it doesn't even say parent, it says an individual or his or her parent or guardian goes to a pharmacist, does that pharmacist know that person's medical records? Do they know that child's medical records? We can ignore adverse events of vaccines all day long, and the general public typically does. But what if one kid gets affected because they had some allergy to an ingredient, or they had some precondition they weren't aware of, but the doctor might have been aware of, their pediatrician might have been aware of, but that pharmacist might not have been aware of? That's the reason I'm going to be voting no on this bill. I think it's a little bit reckless to be issuing out vaccines that do have potentials for bad adverse events, and to be opening a door where it can be easier, more accessible with less oversight. Thank you.
Boone 11.
Yes to no.
Recognition, Senator from Henderson.
Yes to no.
Senator from Pike.
Yes or no?
This bill is just touching on the very tip of what we've continued to recognize in Kentucky, that we desperately need a wellness revolution. But does it start by an injection into your body? Does it start by a 4-year-old that has walked to the pharmacist, as opposed to a very thoughtful recognition of how do we raise this healthy, vibrant young person? So many of our young people, and statistics are becoming shocking on the amount of children with disabilities, learning challenges, learning issues. Is it because of what's in our food? Is it because of food dyes? Is it because of some of these things? Perceptively, you would think a vaccination is there to promote wellness, when in fact, we're allowing additives in people vaccines that aren't even allowed in pet vaccines. Do we know that in this caucus? Do we know that our pet vaccines are actually safer than our people vaccines? We are continuing to promote and advocate something that isn't actually your control. It's now in the doctor's or the pharmacist. We must own our health. We must be committed to our children's health. This is not promoting health for our children. This is not promoting health for our families. I just encourage and urge that we vote no on this, and we take a much closer look on leading ourselves in Kentucky to a wellness revolution. Thank you.
You know, it's easy to assume that people have access to care, particularly in rural Kentucky. It's not there. What do they do if they don't have it? This is not mandating any new vaccines. These things are tested vaccines over the years. What are families supposed to do? That's very easy to say. Just get in your car and drive a few miles up the road. If you think that way, then you don't really understand rural Kentucky. And what a challenge it is to drive even 5 miles up the road. Does this make the situation worse? No, it does not. Are there problems we need to address in healthcare? There are a multitude of problems, but in the meantime, we need to slap some kind of Band-Aid on this to try to make it just a little bit better. If you're voting against this based on principle, you're cheating the children of Kentucky, particularly rural Kentucky, and I can't begin to tell you how disappointed I am in that.
There being 26 yeas, 11 nays, House Bill 274 is finally passed.